Thanks very much for the introduction and for having me along tonight. So the objective for my presentation tonight was for participants to acquire increased knowledge and confidence in the nutritional management of cancer patients and survivors. So I've tried to make tonight's session and my section of it really practical, and I'm going to go through 3 short cases and look at some of the things that we did with the patients to help them to eat and to get in enough nutrition. So hopefully everyone will be able to take away something that they could tell one of their patients at some point in the future in terms of practical advice. So just a few stats. I think we're all agreed nutrition's important. That's why a dietitian's speaking tonight. But 40 to 80% of cancer patients lose weight during treatment, and this is a major prognostic indicator and quite significant in terms of their treatment, in terms of being fit enough for treatment and coping well with treatment. So nutrition intervention can make a difference and prevent unplanned admissions and breaks during treatment, and basically we're aiming for weight maintenance during the active phase of treatment. And preventing malnutrition is really the key. So it's a lot easier to prevent and deal with problems as they come up than rehabilitate a severely malnourished person, you know, who's already had a lot of weight loss. So we're up against a few things in terms of trying to keep people's weight stable. Metabolic abnormalities of the cancer, which we can't necessarily do a lot about. Treatment side effects such as loss of appetite, mucositis, nausea, vomiting, diarrhoea, constipation, you know, which can be worse during combined treatments when someone's perhaps having maybe chemotherapy and then followed by surgery and maybe even some treatment after that again. And then mechanical issues of the tumour itself. So you can imagine if you've got a big lump in your tongue or in a tumour in your esophagus, it's quite difficult to swallow and eat. 30 to 50% of head and neck patients are malnourished right at the start, unfortunately. So I'm going to go through a few side effects and some strategies to deal with them and then talk about the cases quickly. So having a look at loss of appetite, probably one of the most common things that I find patients say is stopping them from eating. So generally we talk to people about eating small amounts frequently through the day of nutrient-dense meals and snacks. A large meal can be quite overwhelming and really put someone off to the point where they just don't bother eating anything at all, which sort of defeats the purpose. Dietitians talk to people about avoiding drinking large amounts of liquid with a meal, because that of course can affect satiety and get that early feeling of fullness. Making meals really nicely presented, attractive colours, herbs, spices, flavours. Sometimes, particularly with nausea, a lot of people find just the smell of food or being inside the kitchen makes them go rushing for the toilet, wanting to vomit. So staying right out of the kitchen when food's cooking. I've got a patient who goes down to the garden when his wife's cooking dinner, just right out of the way. Or going for more cold foods, so along the lines of things like quiche, potato salad, pasta salad cooked at home, that can still be very nourishing, energy-rich meals, but without that smell. And a small amount of alcohol, in line with GP and oncologist recommendations, can stimulate a little bit of appetite. And I've included fatigue here because this is a big problem during radiotherapy in particular. And often, because dietitians will usually see patients before the radiotherapy starts and talk with them about planning for treatment and accepting any offers from family and friends to cook or to freeze food or to stock up their fridge and freezer. Taking pre-prepared snacks is really helpful for long journeys and long treatment days, and stocking up the pantry with non-perishables. So if during treatment they're too tired to cook and shop, there's things there. Dietitians at our hospital often talk to people about getting some pre-prepared meals. If they've got a deep freezer, chocking it up with those sorts of things. Bought a few booklets to have a look. So we sort of try and say, look, Meals on Wheels aren't just for elderly people who can't cook. They are useful during treatment when you're tired and you might be very busy with a lot of appointments. So having a look at the first case, I've got Mrs. AG. So she's a lady, 56 years old. She's got cancer of her pancreas and she's having some chemotherapy. She's recently lost some weight. Her problems are low appetite, this early satiety or feeling of fullness, diarrhoea. She's got some fat malabsorption and fatigue. So nutritional goals, her cancer's inoperable, just to maintain weight, to sort out this fat malabsorption so she can feel a bit better, get a bit better quality of life. So we'll have a look at what a day's intake might look like after chatting with her and trying to put some things in place. So we've got 3 meals and then 3 or 4 snacks spread in there through over the day. With the fat malabsorption, she's needing 25, a minimum of 25,000 units of a pancreatic enzyme with her meals and 10,000 with snacks to help stop that diarrhoea. We've done a bit of food fortification, so you can see there's a bit of extra cream into some of the meals, particularly porridge and then milk powder into the soup. So that's one way of making a small meal high in energy in the case of cream, or particularly higher in protein in the case of the milk powder, so that the person then doesn't need to eat a much larger meal but can get more protein and energy in that small volume that they can manage. So you can see a lot of the snacks are quite energy dense, so cheese and also nuts, and fairly plain sort of foods, so nothing very rich or high in fat that's perhaps going to make her feel very full early on. And she's got some family helping doing some cooking with her. So I'd just like to talk about dry mouth as a problem. This is particularly an issue with head and neck patients having radiotherapy. But can be a problem in other settings too. So making sure that meals are really moist, using a lot of soup, sauces and gravies is very helpful. Cutting up food to make it a lot smaller so people aren't needing to chew it as much, and frequent sips of fluid through the day and during a meal. Using a lot of good oral hygiene to keep the mouth clean and fresh, and oral lubricants. So I've brought a few samples to have a look at. If anyone's interested. But a lot of people just say sipping on fluid through the day is the most useful thing. But this is quite important with meals, because I guess a lot of people explain to me, oh, I try and eat croissant or cheese and crackers, it just goes round and round in the mouth. So some of these strategies really make quite a difference. And avoiding things that will dry out the mouth more, like caffeine, alcohol and tobacco. So just looking at another side effect, which we'll talk about in case 2, constipation. It's a pretty big problem when people aren't eating very much, and if they're on analgesia or other medications that contribute to this. So generally we'll talk about increasing fibre intake. So sometimes this might involve using fibre supplements like Metamucil or Benifibre into soups or stews, particularly if someone's on quite a liquid diet with other problems. Plenty of liquid to stay quite well hydrated. Eating regularly through the day to stimulate the gut, and little bit of exercise if the person can tolerate it. Daniel will talk a lot about that. And then the patient may need some aperients if they can't manage with dietary strategies. So just having a quick look at the second case I've got here. So Mrs. CM's a 62-year-old female. She's 62 kilos. She's got a cancer in her soft palate, and she's halfway through a course of radiotherapy. She was quite well nourished prior to treatment. So she's got a very low appetite, a dry mouth, which is painful swallowing, constipated because she's on analgesia for the painful swallow, and she's got some quite altered taste. So she tells me that all food tastes like a wet book. So that's straight from the patient's mouth. So the nutritional goal during treatment is to try and keep her weight stable. because we know she'll cope better with treatment, have better quality of life if we can keep it the same. So having a look at what we managed to get her eating. So she's going to need quite soft, moist food because her mouth is just really dry as toast. Sipping fluid in between those small meals and snacks is helpful, and she's using some of the oral lubricants as well. So you can see, because it's quite a painful swallow, nothing in there is very rough or coarse, and there's no strong juices or tomato-based foods that are very acidic and likely to sting in the mouth. And most food is liquid or sort of a mince type texture. So because of the low appetite, we've split the day into 5 small meals or snacks. We're doing some food fortification with the extra cream. And because she's got no taste, tried adding a lot of extra flavour, so the extra cinnamon and vanilla, so that she can get some taste from the food there and enjoy it a bit more, which in turn is likely to help her to eat more. And we're needing to use some liquid nutritional supplements, such as the Sustagen, particularly with the fibre because of the constipation, made up with the full cream milk, and we can meet her energy requirements doing that. So she's just needing some supplements in between the meals. So then I just wanted to talk quickly about mucositis and esophagitis. So again, avoiding those very stingy, acidic type foods is quite important. Adding lots of sauces and gravies again, and salty, rough food and that sort of thing is going to aggravate or make it more difficult to eat. So soft, bland, plainer foods are more helpful. And because the mouth or the esophagus is a lot more sensitive, avoiding food that is very hot or very cold, because that's likely to be painful. Avoiding alcohol is quite important in this time, as that's likely to sting, and some of the fruit nectars are more helpful instead of citrusy foods. Usually during mucositis or esophagitis, depending on the grade of it, it's likely that someone's going to need liquid nutritional supplements or possibly enteral feeding. Adequate mouth care is quite important, analgesia to help the person be able to swallow, and sometimes using a straw to direct away from the painful areas is quite a practical sort of thing that is a useful hint. So just having a look at the last case, this is Mr. S.A. So he's 63 years, he's an 88 kilo male, so he's a lot bigger than the last 2 people we've talked about. Prior to commencing treatment, he only had mild dysphagia, and now he's about 2/3 the way through some chemoradiotherapy for his esophageal cancer. And he's planned for an esophagectomy in a few months, so he's someone that we want to keep pretty fit through this treatment. He's got severe reflux and esophagitis. It's very painful to swallow. You can only tolerate liquids. His nutritional requirements are a lot higher because he's a much bigger man, and we really want to keep his weight stable through the rest of this treatment. So you can see he's only really able to take very liquidy foods. So a lot of the food's needing to go in the blender. So often you'll hear people say, oh, can take Weet-Bix, but that's usually Weet-Bix with a lot of hot milk over it to make it go nice and soggy and smooth. Custard and a salmon mornay pasta type dish in the blender. But you can see we're mainly relying on liquid nutritional supplements to meet this man's requirements, simply because during this time it's quite difficult to swallow and he's needing quite a bit of analgesia. So predicting that he might have problems with constipation, we've got him on a fibre type, oral nutrition supplement containing fibre. So the last 2 sort of nutrition impact symptoms I wanted to talk about is diarrhea and nausea and vomiting. So diarrhea can be quite a problem depending on where the tumour is and what type of treatment they're having. But basically maintaining fluid intake is quite important to prevent dehydration during this time, and avoiding food or drinks that might exacerbate the diarrhea or make it worse. So gut stimulants are alcohol, caffeine, artificial sweeteners, and a lot of very fibrous, coarse food, so a lot of raw fruit and vegetables, things with skins, whole grain products and that sort of thing should just be something to steer clear of till the diarrhea is settled down or under control. And a lot of very high-fat, spicy food is likely to make this worse too. So gas-producing veggies can not be very helpful during this time, so steering clear of them. And then depending on if the person appears to be worse with lactose, looking at substitutes to dairy products and revision of appearance and that sort of a thing during that time. And the nausea and vomiting, the same as low appetite, something that's very common during cancer treatments. Again, looking at small, frequent meals that are energy dense, cool, clear beverages that are well tolerated, like soft drinks or cordials to keep up the hydration and the electrolytes again. Cold food, if the smell of food is a big problem, and dry, starchy or salty foods might be better tolerated. Greasy, rich, spicy and very sweet foods can make things worse. But I don't generally routinely tell people to avoid these if they've got nausea. You know, sometimes I see people and they say, oh, I've had this terrible nausea and then I just smelt this fish and chips and I went and ate it and it was great, you know. So everybody's a little bit different. And you can just give the advice that these things might make the problem worse, but to be guided by what's working for them at that time. So my top tips for nutritional management during cancer would be to let patients know that nutrition is important and maintaining weight during treatment is important. So dietitians often talk to we're blue in the face about this, but if the GP or the oncologist says it, the patient does it. They find it very important. So please, that would be great. Encourage patients and carers to monitor their own food intake and their weight. So I guess if you make them aware that it's important and if they monitor it themselves, and to let someone know if they're losing weight or they can't eat, so that then some action can be taken. Refer to a dietitian in this case. Monitor patients with high-risk nutritional cancers or just generally high nutritional risk in general. So elderly people, socially isolated people, the cancer types I've talked about, the head and neck and the upper gastrointestinal tract particularly. People who are having multi-modality treatments, chemo and radiotherapy combined, can sometimes end up with a lot more side effects, or perhaps are having a long, very long, prolonged course of treatment, possibly some surgery and some treatment. So there's going to be more chance of side effects during that time. Aim for optimal control of symptoms, the nausea, the diarrhea and the vomiting. If we can get these things under control, people are going to be able to eat. So, and encourage people to have regular meals and snacks, and most of all enjoy their food. So just to talk briefly about cancer survivors, so this can potentially be a very different nutritional management compared with during treatment. Depending on what type of cancer they've had and what sort of treatment, but it can sort of be a complete turnaround from where you were before. So I've put up the World Cancer Research Fund Dietary and Lifestyle Guidelines, which talk about being in a healthy body weight, physically active, limiting these energy-dense foods and drinks that I've just talked about the other patients having heaps of, mostly foods of plant origin, limiting red meat, processed meat and salt. So basically a healthy diet that the general population should be following. So this little booklet that is out the front is great and basically has a lot of this information but with practical ways about how to achieve these things. So I just want to follow one of my cases through. So this is Mrs. CM. So she was the lady with the head and neck cancer. So she's 3 months after treatment. So it's some time to give her dietary advice about cancer survivorship. She's got the all clear. So if we have a look, she's still got dryness in her mouth, so still needs more liquidy food and drink, but all of her other side effects have basically resolved. So you can see if you look at a day's intake, you've got mainly whole grains with the wheat bix as host. You've got good 3 serves of fruit in there, and with the pumpkin soup and vegetable casserole, she's up to much more decent sized serves now, so you're getting the 4 or 5 serves of vegetables in. Low fat products, and her husband's a chef, so the pumpkin soup and the casseroles are made without a lot of the extra salts and things like that. So it's an example of how a survivorship type diet would look. So my top tips for after cancer and survivorship would be that this is probably a good window of opportunity to get information or advice into patients. They're looking for change. They've just come through a big experience that's been quite significant in their lives. Exercise programs are a great way to rebuild strength and to form good habits. So I'm always giving out Daniel's pamphlets for ECU. And I guess a lot of the patients that I see would have quite low mood after treatment as well. So that's sometimes how I try and encourage the exercise as a good outlet, possibly a way to get back into a community group, and generally the mood benefits of improving your mood with exercise. And I guess luckily with the recommendations for cancer prevention or survivorship are not that different to advice you'd give for general health. So I guess it makes it easier. Lots of people say, oh, I can't follow this, I need to follow this diet for blood pressure and this diet for diabetes and this diet to prevent my cancer. But it's really similar advice. So that's a good message to send to people, is that it's nothing significantly different from the general population. So I think people would have seen this booklet out the front as well, which is a fantastic booklet for during treatment for people who are having cancer. So I'd encourage you to take a copy of this and have a look as well. But that's basically it from me.